Human trafficking is far more prevalent than many people realize. It is a lucrative, illicit activity with estimated annual global profits of $150 billion US. Trafficking in persons has been recognized by the international community as a human rights violation and is considered a contemporary form of slavery. Each year, hundreds of thousands of people are trafficked globally and placed into conditions of sexual exploitation and forced labor. Statistics support that trafficking in persons is one of the fastest growing and most lucrative criminal activities globally. Dr. Richard Schoeberl and Dr. Kelly Cloonan discuss a public health approach that recognizes many victims of trafficking intersect with multiple systems of care, including health and human services. A public health approach emphasizes screening to prevent potential trafficking victimization or re-victimization, especially for individuals who are at disproportionate risk of human trafficking. Up to 80% of victims are seen by a healthcare provider, and these providers are often the only professionals to interact with trafficking victims who are still in captivity, thus the importance of this training.
I want to thank everybody for providing us this opportunity to talk to you guys a little bit today about human trafficking, particularly in a clinical setting. My name is Richard Schoeberl. I am with an organization called Hope for Justice. Prior to working with this organization, Hope for Justice, I worked with the FBI for numerous years and the National Counterterrorism Center, and a research professor in researching human trafficking and the effects of it globally. Today I have with me Kelly Cloonan, and I'll let Dr. Cloonan talk about herself.
Hi, I am Kelly Cloonan, and I'm excited to be with you guys today to share this information. I've been a nurse educator for over 10 years now, and I currently work at Chamberlain University developing curriculum and educating students. So I'm excited to educate you all today on trafficking and things to look for in the clinical setting.
And I think everybody knows, otherwise we wouldn't be having this Zoom, that, obviously human trafficking is a lot more prevalent than we realize, and it knows no boundaries. It has, no prejudice, except for those who are most vulnerable. It's an extremely lucrative business, and that's what it is. And spent a majority of my career working counterterrorism, and I always thought a terrorist was the worst person that I could have ever interviewed until I met a human trafficker. And then I realized anybody who that can exploit somebody for money, it's got to be the worst person I've ever met in my life. It is one of the reasons why I became involved in this movement and to educate people a little bit more about what's going on, a little bit about what Hope for Justice is and who we are, so kind of establish what it is. We are a global nonprofit. We're located on 35 locations across 4 continents. So odds are somewhere where you're located, we have an office that we work locally with governments, with law enforcement, with community leaders, with religious leaders, and so forth. We know that trafficking in persons is one of the worst things, particularly when we look at women and children, and in various locations, and that's why we are involved in this fight. This particular educational format will focus strictly on the clinical aspect of it.
Yep, and the clinical human trafficking prevention training will focus on the accurate identification, screening, reporting, and response to suspected exploitation form of human trafficking. The training is based on extensive literature reviews, information gathered through interviews with subject matter experts, including survivors of human trafficking and service providers across the public health, behavioral health, healthcare, and social work sectors who deliver services to individuals who have been trafficked or are at risk of being trafficked. Hope for Justice also gathered, organized, and reviewed promising practice recommendations from experts and survivors and anecdotal evidence from successful anti-trafficking efforts to develop this training. The prevention training will include the following. 1, we will recognize the emotional, behavioral, and physical signs of trafficking, commonly known as red flags. 2, respond appropriately and sensitively through screening to assess the particular needs of your client or patient. And 3, make appropriate referrals for services.
So when we talk about trafficking, I want to make sure we kind of lay down the framework and talk about some of the facts and why it's so important. We know that human trafficking is the second fastest growing crime on a global scale. Why? Well, we know it's behind drugs and then arms dealing, but we know that the fact that human trafficking is the second fastest growing crime because a person can only sell that drug once, but they can sell that child, that female, that male over and over and over again. They are a renewable commodity that they can continually sell. And each year, hundreds and thousands of people, primarily women and children, are forced into human trafficking situations, whether it's through labor or sexual exploitation. Now, just to give you some of the hard facts in here, 40 million people are trapped right now in slavery. Now, when we look at this statistic, due to the clandestine nature of and the lack of uniform data and reporting, statistics are really only as good as those statistics that are reported or gathered. So likely when we say 40 million people, there's probably more, because if we're not recognizing the fact of the people that are being exploited or are being held in domestic servitude or sexual exploitation, then they're not being reported. It generates $150 billion a year. That's a lot of money. And when we talk about the exploitation and the amount of money that it raises, when I tell you that $150 billion a year, it's obvious why people are involved in it. It's motivation of pure greed. Now, some of the regional facts that I kind of want to throw in here. So regardless of where you are on the globe right now, we know that it differs region to region. Human trafficking is not homogeneous across the platform. It's different in each country. It's different in each region. There are different push and pull factors, but trafficking patterns we know differ. In the Middle East, we know that because of a lot of the conflict, the displacement, that it's on the rise. Just this past year, 600,000 victims of 45 different nationalities, not just from the Middle East themselves. In South America, we know that women are victims of human trafficking and typically are trafficked within their own country or their neighboring country. They're not exported out. They're mostly kept there. In Europe, 95% of sexually exploited victims are women and children. 95%. In Asia, 25 million victims are in Asia. That is almost half of the world's total. And then in Africa, we know that any given time, 3.5 million people are being trafficked. So when we talk about trafficking, a lot of people are like, what is the definition? What is comprised of trafficking? Because there's more than obviously just one type of trafficking. We look at forced labor, and we know that that's regional. We know that forced labor can take place in any country, but the statistics and the percentage of the people who might be in forced labor vary from country to country. Sexual exploitation is one of the largest. If we're going to break down the types of trafficking, your top two are going to be your forced labor and your sexual exploitation. Most of the forced labor would lean heavily on our male population, and most of the sexual exploitation would lean heavily on your female and young children population. We looked at forced marriage or even temporary marriage. We're starting to see a rise in that in a way to get around the situation. We also have domestic servitude, forcing people, luring people. We'll talk about each one of these as we go through here. Criminal activities such as forced begging and so forth. And then organ harvesting. We know that some people will sell their kidneys for $5,000 and then the trafficker will sell it for $150,000. There are currently children being raised in order to just particularly harvest their organs. So when we talk about defining it, okay, we want to look at, I guess, the United Nations uses kind of these three elements when we look at what defines human trafficking. So the act itself. And when we looked at the act itself, like what's being done, okay? And that's where we talk about the recruiting somebody, whether it's through false means or not, whether it's advertising a job, but that job is particularly not the job that they signed up for when they get there, transporting somebody, transferring somebody, okay? When we talk about that, that's the act itself. The means, well, the means is either through threat or coercion. When we talk about coercion, we talk about, fraud or deception, and we mean like advertising for a job. Somebody comes to that country, it's not the job that they had, or they take their documents from them. They don't allow them to have their documents anymore. They don't speak that language. They don't know the customs. Then they feel trapped within that environment. And what's the purpose? Why would they do this? Well, they'll do it for forced labor or sexual exploitation. Sometimes note that those two can have a lot of bleed over. Individuals can be brought in to be forced labor, only to be turned into sex slaves or sexual exploitation when we look at that. Now, obviously, a lot of you know this, that the Department of State defines it as force, fraud, or coercion. And we look at force, fraud, or coercion, we look at those three elements. Not all three elements need to be met, but we also know that a lot of people will always ask, well, what if the individual is addicted to drugs? Well, that's a means of control. A lot of times we will see these traffickers addict some of these females to drugs as a means of addiction and controlling them. So that does fall into that aspect of it. Now, when we get even further into this, we talk about, the recruitment and migration. We talk about the denial of personal freedoms, and we talk about the many different laws. A lot of people who migrate from various countries are trying to leave a situation to get to a better situation. And as we move through this, we'll talk a little bit about what we refer to as push and pull factors, or the trafficking funnel. What funnels an individual into the trafficking situation? What pulls them in or what pushes them in? And a lot of times these individuals get into a position where they may be recruited to come to a country. And once they're there, then they may lack the awareness of their rights within that country. They're isolated. They lack the local knowledge of the language, the local knowledge of the customs. They're paid very low wages, if at any, to start, and then it's kind of tapered off from there. So when we talk about it, who could be a victim here, we look at those who are most vulnerable, those who are looking for a better life and get put into a position where they are denied now their personal freedoms. And then within this aspect that they're denied their personal freedoms, then they have no place to go. Okay. And when we look at kind of the international laws and the organizations in regards to this, obviously a lot of these countries have different laws that pertain to human trafficking. But having a law is one thing. Enforcing a law is different. We know that a lot of countries do not enforce, do not investigate. A lot of them will shun the human trafficking reports off as prostitution or other types of crimes. And they don't look at it as what it is when we talk about human trafficking. So a lot of people confuse human trafficking with smuggling, and they're not the same. Obviously, they're different. Otherwise, they would have the same title, but they don't. Trafficking and smuggling are different. There are some commonalities when we look at human trafficking. They're both a profitable business, and they're both usually operated by criminal networks. Now, can smuggling lead to trafficking? Absolutely. A lot of people try to get out of the country that they're in order to get into another country, like I said before, because they want a better life, right? They're trying to go there and make money. They want something better for themselves, for their families, etc. So they pay somebody to smuggle themselves into a better situation, only to realize that once they're now in that situation, it's not quite as good as they thought it was. And now they're being held in debt bondage, where the trafficker will or the smuggler will basically say, hey, listen, you didn't pay me enough. Now you're going to have to work for me. I'm going to give you your documents back once you have worked for me a little bit longer and have paid this off. So the key word that I like to tell people in the difference between the two in trafficking and smuggling, one is voluntary and one is involuntary. A lot of people will voluntarily be smuggled into another country, but I've yet to meet a single person who has voluntarily raised their hand to be trafficked. No one has ever raised their hand to be trafficked. So when you look at it and you want a simple one word, just know smuggling, voluntary, and then the other one, non-voluntary. So when we talk about what funnels somebody or what pushes somebody into a trafficking situation, we kind of got to look at the push and pull factors within those countries. And obviously stability is rather a key when we look at this. Sometimes people have either instability in their current country, whether it's political or economical instability. Maybe they're living in poverty. Maybe they're living in an abusive home or an abusive environment, and those things can push or compel people to enter situations that are more higher risk, and that would put them there. Pull factors. When we talk about pulling somebody into a situation, we talk about the types of things that would be a lucrative job offer in another country, an advertisement for a job in another country, and that would pull them into that country. And then, there's obviously, we look at the more push, the stronger the pull. And that's always seems to be the case when we look at that. Now, when we kind of break this down, and you put push and pull kind of side by side and kind of view those, look at some of the factors that would push somebody out of their country into a country maybe where you are today. Are there neighboring countries that have a natural disaster, poverty, homeless, unemployment? Is there conflict, regional conflict? Is there a war, terrorist activity, things like that? And then we talk about what pulls people to that country, and those factors would be the demand side, the demand for employment. If they're looking to get out of there into that country and they're looking to leave that country for a job or an opportunity for something that's better than what they currently are in. And I always talk about people, when, I'll just use this an example, when people are willing to cross through a desert with a dirty gallon of water to get to another country, how vulnerable do you think that they are when they get there? Pretty vulnerable, and they're easily exploitable. And we know that these traffickers that exploit these individuals prey on those who are most vulnerable. So when we look at some of the common victimization or some of the common pathways, we can talk about abduction. And I'll often refer to the movie Taken with Liam Neeson. That's so Hollywood-esque that, people are abducted. Sure, absolutely. Is that the most common form of trafficking? No, absolutely not. It makes for a good movie for Liam Neeson to have 3 series of it, but it's not really what we're talking about, even though it does happen. Okay. Meeting the traffickers through advertised for modeling jobs. Yeah, absolutely that happens. And it's not just modeling jobs, it's just jobs in general. People are looking to escape the poverty or the situation in the country that they're in. And they can either take this job through an advertisement, or it could be brokered. It could be an individual. We know that a lot of people sometimes will go from countries that they once were in and work as a broker for traffickers and go back to that country and show their lavish lifestyle that they have now because they've been working in the host country. And they'll recruit these young women and young men to go to these countries to do some work. They'll get there, and then obviously once they get there, they can be exploited for labor or for sex. And sometimes, people say, can a person be both? And absolutely, that is very common, where you will have a person who was originally recruited to be labor, and then that kind of transversed into or bled over into sexual exploitation. So yeah, they can be both there. Okay, they can be both there. Sometimes in some of the countries, which is unfortunate because it's hard for me to even fathom this as a parent myself. But a lot of times, some of these individuals are trafficked or sold as their own parents. And I'll give you a quick example of that. We have several offices in Africa, and one of the traffickers actually came to the village in Africa and had spoke with the parents and said that he was there providing children with an opportunity to get an education. And by getting this education, they would work on his farm. And by working as a laborer on the farm, they would pay for their tutelage and pay for their education, which then would push them into a collegiate setting. And a lot of parents were fall prey to this dubious act. And when they left the village with this individual, they were not only exploited for labor, but the young females were exploited for sex as well. Fortunately, those victims were rescued from the situation, but they were made a false promise, and then they were fooled, and then through that they wound up being exploited, and that happens more common than not. And the parents thought they were doing the right thing. The parents actually thought that they were putting their child in a better situation than what they were, and these young women and young men ended up being exploited.
So as healthcare providers, we are one of the few professionals that are likely to interact with trafficked women and girls while they're still in captivity. And this really represents a missed opportunity for intervention. We're in a unique position to identify victims of trafficking and provide important physical and psychological care while they're in captivity and after. And it's estimated that up to 80% of trafficking victims are seen by a healthcare provider. And in the healthcare setting, they rarely identify as a victim. They don't identify themselves as that. So it makes it difficult to recognize them. And healthcare providers, as I said, are often one of the only professionals to interact with victims while they're still in captivity, which is why you guys are all here today and the importance of this training to learn how to identify them. And it's increasingly recognized that healthcare providers have an important role in victim identification and response as advocates, collaborating with national, regional, and local agencies to increase awareness of sex trafficking as a public health problem and to address the needs of adult victims and survivors globally and in the United States. So the health problems seen in victims of trafficking are largely a result of several factors: deprivation of food and sleep, extreme stress, hazards of travel, violence, both physical and sexual, and hazardous work. And most victims don't have timely access to healthcare, so by the time they reach you as a healthcare provider, it's likely that the health problems are very well advanced. Women are at high risk for acquiring multiple sexually transmitted infections and multiple forced and unsafe abortions. Physical abuse and torture often occur, which can result in, things you may see: broken bones, contusions, dental problems like loss of teeth, and cigarette burns, for example. So we're going to take a trauma-informed approach when screening individuals who may have been trafficked. So make every effort to not rush clients through the screening process. The effectiveness of screening for trafficking victimization depends on, allaying fear, building rapport, asking questions in an appropriate manner. Clinicians should be comfortable working with trafficking victims, sensitive to their special needs, and aware that they're likely to be suffering the impacts of traumatic experiences. And I'm going to dive a little deeper into these three categories here and talk to you about just some tips for each of these, how to establish these things. So we're going to start with establishing a relationship. So we do this as healthcare providers already. We want to establish a relationship with our patients. But it's really important here because those who have experienced trafficking may suffer profound physical and psychological damage due to experiencing high rates of physical violence and emotional abuse. So a lot of victims report anxiety, depression, post-traumatic stress disorder, and corresponding psychological symptoms such as aggression, shame, guilt, hopelessness, sleep disturbances, self-injury, and suicidal thoughts. And, be aware, and, we kind of touched on this a little bit already, but be aware that the client may be intoxicated, they may be withdrawing, or even drug seeking, and understand that trauma is still existing. That may be, as Rich explained, that's how it's, they're addicted, and that's part of how they're drawn into this and kept in captivity. So just remember that they might have an exaggerated response when you're screening them or taking care of them. So it might be a startle response, exaggerated, hypervigilance, avoidance. So they may decline to answer your questions or even engage in conversation, having elevated emotions, or even be completely complete disassociation. So where they're detached from the immediate surroundings and almost in a trance-like state. So just maintain an awareness of these commonly occurring symptoms and reactions. A lifetime history of trauma is not uncommon for survivors of trafficking. And just as a reminder, understand that lifetime cumulative trauma occurs on a continuum rather than as isolated incidents. To the extent possible, any psychological symptoms observed are best not addressed within the context of a screening event, as this may agitate a trauma survivor and interfere with screening. But be prepared to handle a trauma reaction if that does occur. So, it may cause a flashback or a panic attack to occur during the screening. So just keep that in mind and be prepared to handle that, and maybe give them a little bit of time and space before proceeding with the rest of the questions. So another thing too to consider that's really important is, if the trafficker is criticized, if you as the healthcare provider are criticizing the trafficker, it may actually cause the victim to come to their defense and may cause distress for that victim. So just maintain a verbally neutral stance towards the trafficker. That is less likely to be perceived as a threat. Many individuals who have been trafficked have had all control taken from them by the trafficker. So offer as much control to these patients as possible during the screening. That can help to build that trust and that relationship. You're not always afforded extensive time to establish that, but there's some things to be respectful of with the victims, and also to keep in mind any type of cultural differences, background, religious differences. So things like social etiquette, customs, religious, observations, attitudes towards prostitution. So be aware that cultural differences may actually make some topics like sex and mental health really uncomfortable for the victims to discuss. And then a couple extra tips for establishing this relationship is, the intent of screening is to promote the safety and well-being of your client. So keep that in the forefront of your mind, that is the purpose of this, to promote safety and well-being of the client. So take your time. Again, I know I already said that, but that's so important. Avoid rushing through the screening tool. Read each question slowly and offer to repeat that if they need to hear it again, or if they seem confused by the question, offer to repeat it. Allow time for the client to process each question and answer at their own pace. Some clients may need to pause before answering a question, so explain that that's okay and that you're not in a hurry. Even if you are, you need to act that you're not in a hurry when you're working with them. Periodically review the red flags checklist, which we are going to provide a lot of these resources to you today. So review that frequently, and the screening questions, and ensure you're really familiar with these questions. If you do that, it's going to really help that you're more confident during the screening, which will help the patient or client feel more at ease during the screening process. So trafficking victims have been often held in servitude through threats of harm and fear of their arrest or deportation by police and immigration authorities. So it's crucial to establish a safe space to help victims feel more comfortable and protected. So to help with their fears, here's some techniques to give you guys when you're doing this. Before conducting a screening, service providers should fulfill some basic needs, such as providing food, clothing, medical care, or assurance of at least temporary shelter if necessary. It may be difficult for a victim to engage in an interview unless these immediate needs for physical comfort and safety are met. As clinicians, you all probably have heard of Maslow's hierarchy of needs. This is that base need. This is the first thing that anybody needs to move up through that. So very, very important to do that. Hold the interview in a non-threatening and comfortable location. Provide the victim with food and drink and incidentals, including tissues, regular breaks, and a place where they could gain composure if the interview does cause them some distress. Never interview the victim within the sight of the trafficker. If the victim arrives with a person exhibiting controlling behavior, talk to the victim in private. This person may be the trafficker or someone working for the trafficker. Sometimes they send in someone else to be with them to make sure that they don't say anything. Maintain a professional but friendly attitude and appearance. And I know we may have some law enforcement here today. Just make sure to dress in civilian clothing and make sure no weapons are in view. Be honest at the beginning about the purpose and duration of the screening. Describe the victim's rights, the interview process, and the role of everybody involved. Employ competent, trustworthy interpreters if the victim's first language is not English. Competent interpreters ask questions using the same wording as the screener and answer as fully as the victim. The victim must be assured of confidentiality. Be aware of gender issues and ask victims if they would be more comfortable being interviewed by someone of the same gender. And when possible, if you can, provide the victim with a preference for their interpreter of a specific gender or culture as well. That should be accommodated. So developing trust and demonstrating respect during sessions is of utmost importance. Trafficking victims need to feel safe with the interviewer before they divulge experiences that may revive fears and feelings of distress or place themselves or their families in further jeopardy. So some service providers may judge that it is in the victim's interest to have a general conversation first and return to the screening questions at a second meeting. But when the victim is ready to answer the victim identification questions, there's a few techniques to keep in mind. Express prior knowledge and experience with similar cases where appropriate, and allow the victim the opportunity to relay any questions or fears they may have. So you don't want this to seem you don't want to seem shocked or surprised by what they're telling you. You want to just say, you've known people in similar situations and you're there to help them, and you know how to help them is really important. Be patient and caring and sensitive to the victim's fears of retribution and the possible consequences of being identified as a victim or a party to trafficking crimes. So many victims are not familiar with laws and victim protection regarding trafficking. Be careful not to ever imply that a victim was responsible for their own abuse and exploitation or for the inability to leave a trafficking situation. Reassure them that others have been in similar situations, and as victims of a crime, they are not to blame. Take the time necessary to allow victims to recount the story, and it may involve having several meetings with them. Allow them to direct the interview and to tell their story in their own words, and they should also feel like they're able to stop the interview at any point if they need a minute if they're experiencing distress. And also just convey some trusting messages, things like, we're here to help you, you can trust me, your safety is my priority, you have a right to live without being abused. So trafficking victims have often endured profound physical and psychological injuries that may impede the efforts of attorneys and other service providers to when interviewing them. And so that may actually impede that relationship that we're talking about. They may exhibit minimization, denial, and memory loss, which are symptoms of psychological trauma, and that can make it really difficult to elicit consistent information. So just know that you may get a little bit of an inconsistent information. It doesn't necessarily mean they're lying. It's part of this affective trauma. So some tips regarding trauma and victimization to keep in mind: be aware that trafficking victims may experience these long-lasting effects of abuse and chronic substance abuse or violent physical and psychological assaults. Even if you're not a mental health expert, a screener can really recognize a lot of these signs of trauma. So don't be intimidated if you are not a mental health expert. As a clinician who screens trafficking victims, you may be the first person to whom victims have reported trauma or mental distress. Express sorrow for what has happened to them, but do not appear judgmental or shocked. As I already said, do not appear that way. You want to express sorrow and empathy. Ask only basic questions about mental health unless you're a trained mental health professional. So if you straightforward, non-intrusive questions asked in a kind manner can convey a caring attitude and help the screener and the victim decide if a referral to a mental health professional is desirable or even necessary. And finally, be understanding when victims do not want to repeat the details of a crime. So keep in mind that recounting the story many times for various people, the clinicians, law enforcement, and others, may cause the victim to re-experience trauma. So try your best to minimize potential for re-traumatization when possible.
So one of the things that we want to talk about in regards to what are the barriers, what prevents these victims from being identified, particularly in a clinical setting or any setting for that matter. But a lot of it is a lack of information about the victims. If we don't know they exist, then how do we know they're a victim? If they don't come in and see us, how do we know they're a victim? And this is the opportunity, like Kelly said, is, this is our one opportunity within the clinician setting for us to identify if these individuals are victims. And a lot of times we will see victims not identifying themselves as victims. A lot of these victims will be put in a situation where they feel like not only did they deserve it, but they asked for it. They're the one who responded to the ad. They're the ones who ended up in this situation. Okay. And now they could possibly be threatened or coerced to remain silent. There's been a lot of situations where they have told, traffickers have told victims, if you run away, you'll be arrested for immigration violations. You could be thrown in jail. You could be beaten. or they could actually physically beat them. They have a fear for law enforcement because maybe the country that they come from, maybe their law enforcement is corrupt, or maybe they've heard stories that their law enforcement, or they had a bad experience with law enforcement. So a lot of times they may fear law enforcement, whether law enforcement is good in that country or not good. So from a clinical setting, if we mention law enforcement immediately to them, we may realize that they're in fear of law enforcement just as much as they are in fear of the trafficker. A lot of times we will see the trafficker telling the victims that prostitution's illegal, and they will be arrested for prostitution because that's what they were. And in some countries, we know that these individuals are mislabeled. We know that they're mislabeled as prostitutes and then obviously not charged. And a lot of that comes from whether it's a customary or religious belief within that area. So the victims often will mistrust law enforcement. So that's another barrier. But just know it, if we don't know they exist, then they can't be a victim because we don't know that they're out there. Other things that we look for when we talk about the victims is most of these victims, when we're talking about sexual exploitation, and remember what I said earlier on about statistics, statistics are only as good as what's reported and what's reported accurately. A lot of times men and young men will not come forward for shame to say that they were sexually exploited. So we cannot accurately say we can capture that number per se, but we do know what we can capture is the number that women and young women are exploited into sexual exploitation. 25% of all victims we know are children. Okay, children. What affects them? And we'll talk about some of the red flags as we move through this. We'll talk about some of the variables that contribute to this. But we know that some of the key variables are poverty. Poverty makes you vulnerable. A lack of access to education, chronic unemployment, discrimination, lack of economic opportunities in your home country. If there are no jobs in your country where you're at, and there's an advertisement for jobs in another country, then most people will go to that country. Most people will seek employment. Most people do not want to raise their hand and say, I want to live in extreme poverty. I do not want to eat. I do not want a roof over my head. I do not want clothes. I do not want a better life for myself. No one ever says that. So people will seek that. And when they do, they become a little bit more vulnerable to the situation of exploitation.
So know that there's many variables to victimization, and not all of the variables need to be present for them to be a potential victim. So using a red flag checklist, like the indicators of human trafficking, which we will be providing to you guys today, will help determine if further screening for potential human trafficking is appropriate. Know the red flags indicators of human trafficking was modeled after one developed for use by healthcare providers that incorporates signs of trafficking in both minors and adults. And it's also intended to be used as a means for helping you recognize the signs of adult trafficking and really determine if further screening is necessary. So recognize that individuals who have been trafficked, as we talked about, they've experienced a lot of oppression and control in varying degrees, which can be inadvertently perpetuated in healthcare and social service settings. So in fact, screening can unintentionally result in decision-making on behalf of the person perceived to be vulnerable without regard for their own sense of dangers behind those decisions. So we do this a lot in healthcare. We make decisions for our patients. We do a lot of things. So just be aware that, these victims have had no control or had a lot of that control taken from them. So do your best to give them some of that control. And we're going to talk about that a little bit more. So resist that overwhelming urge to assist in a manner that will overshadow the will of the client. Okay, that's the biggest take home. And simple ways that you could promote this ability or the right for them to make consequential decisions include allowing the client to set the pace of the screening process, allow the client to decline to answer any questions, allow them to choose what resources or services they want and need and how they wish to access them. This may look like you calling, a referral or a hotline together. allow the client to be a part of the decision-making process, that may help to calm their fear and anxiety. And, when you think of patient-centered care in general, which is something we should all be doing, same thing here. We want to allow them to be part of that decision-making process. And that's really also a key component of survivor-centered practice. It signals that the needs, wishes, goals, and priorities of the clients are important and that they are valued. So simple ways to do this may be allowing them to choose where they sit, allowing them to choose what snack they want, telling them where the bathroom is so they don't have to ask permission later. So keeping them informed of all those things and making them feel that they have a choice for some of those decisions.
And just to kind of follow up a little bit on what Kelly was talking about, is allowing these patients to the opportunity to choose and be involved in the decision-making process. So you have to think for a moment that these individuals, every movement of their life has been controlled. And you are now establishing that trust and rapport by affording them the opportunity to make these choices on their own, something that's foreign to them, because they haven't been making these choices on their own. They've been told what to do, what to wear, where to go, when to sleep, when to cook, when to perform sexual acts, what have you. They are being controlled. Now we are affording them that opportunity to be involved in the decision-making process, thus bridging that gap and establishing a little bit more trust when we talk about it. Now, when we talk about some of the key indicators, so if we go back to the screening tool and the screening process that Kelly was talking about earlier, obviously when a patient comes in, you're not going to automatically pull out the checklist and go, okay, so now let me go ahead and start doing the screening tool. Oh, okay, so you're not being trafficked. Okay, well, I found that out. Well, before we get to that step, we really need to see, are there any key indicators that might lead us to the fact that this person might be trafficked? And some of those key indicators, and I always tell people that, there's 100 different recipes for a chocolate cake, okay? They'll all be a chocolate cake at the end, but they all got different ingredients. So the same thing when we talk about spot the signs. When we talk about spot the signs for key indicators for trafficking, not every one of these need to be present. There's not a checklist that you go down and go, okay, physical and sexual violence, underage, okay, deception, okay. You don't have to check the box on every one. But know as we go through these, the root causes of trafficking, and obviously they do differ country to country, so know that, and know that it's, very complex and it's driven by a lot of different factors, whether social, economical, cultural, whatever. But when we look at these red flags, recognizing these are really our first step, okay, in identifying the victim. Okay, so when we go through this checklist, look for these things, and maybe that light bulb will go off on your, in your head. And, one thing that Kelly had mentioned previously was take your time. Okay, there's no possible way you can recognize all of these key factors in a short period of time. Okay, all of these factors play into or play a role in proper victim identification. So is there physical or sexual abuse or violence, present in the situation? Okay, check. How about that? Were they deceived to come here? Okay, and you can find that out going through the screening process. Is there, signs of abuse? Have they been intimidated? Okay, are they fearful? Or do they seem anxious and have a high level of anxiety while they're there? Are they fidgeting? Are they constantly looking over their shoulder to see if somebody's in the room or trying to peek into the room? Are they scared to talk? Okay. Is there signs of prolonged abuse? Okay. Whether that be, bruises that have been covered up or cuts or scars or, poor, oral hygiene, broken teeth or things like that. Is there a prolonged infection that could have been easily been treated a long time ago, right? And then, another key indicator is when's the last time you've been to see a doctor, or how long has this been going on? If they can't remember the last time they saw a doctor, okay, that's another key indicator right there. If they're not, when we talk about whether they're free to come and go as they please, keep that in mind, that if they didn't come to the hospital or the clinic by themselves, they were escorted there by somebody. Okay, if that's the case, or if they have to ask permission to go to see a clinician or the doctor, or we know that they may be routinely providing commercial sex acts. They've admitted that, they told you that, or you can just tell that. They are paid, but they're paid very little, okay? They work long hours. Obviously, you can tell what fatigue looks like. We'll talk about a case study at the end of this training that basically checks every box in this. There was no way this person couldn't have spotted this. They may owe a large debt and unable to pay it off. And remember what we talked about when we talked about the difference between smuggling and trafficking, that sometimes a person can incur that debt even after they paid to be moved somewhere. Okay, and now they have to work that off. Okay, recruited through false promises. They came here to do one thing, and now they're having to do another thing. Okay, keep in mind, when somebody is fearful and they don't want to tell you the truth, or they're fearful to tell you the truth, they won't look you in the eye and talk to you. They're very uncomfortable. They'll look down, they'll look away. They're ashamed, okay, of what they're doing, and they're avoiding that eye contact with you, avoiding social interaction. A lot of times, sometimes people will go someplace, they'll sit down, they'll look at the person beside them and start carrying a conversation with them, okay? Maybe that's limited now with the COVID. Everybody's trying to keep their 6 foot of distance, but typically most people are social by nature, okay? And when people keep to themselves and they seem reclused, then obviously there's a deeper problem there. And, always dig deeper when you hear a rehearsed response to something. When you ask somebody a question and boom, it automatically sounds scripted. I mean, most of you probably have kids, and when they're lying to you, when their response is pretty much scripted. So, think of it as the same way when we're talking about victims. You can tell that their response has been rehearsed, that someone else kind of told them the verbiage or the way to respond. And then also, too, a lack of identification documents. Why would somebody be in another country without their identification documents? That would be odd in itself for that to happen. So, keep in mind of fear and anxiety. Also look for depression. When we start looking at these, I guess we try to call them the totality of circumstances. And when we start adding all of these ingredients into this, we can start looking at what's becoming more and more traumatic, fearful, anxious, depressed, tense, submissive. When we start looking at all of these ingredients, we're starting to see the building blocks for trauma. So what's causing that type of trauma? And is it the trafficking that equals that trauma? That's your red flag. That's your spot the signs. That's what you have to start realizing. Okay, now I'm going to go from this red flag checklist that leads me into the screening process, because I've got enough there. Okay, it wasn't just one, it wasn't just two, it wasn't all of them, but it was enough that raises my suspicion. And a lot of you have been in this field long enough to realize that your intuition, plays a big role in it. And I always tell people, I would rather be wrong about something than go to bed that night wondering if I should have done something that day. So I always think about that, and I'm like, you know what? I'm going to report it anyway, or I'm going to dig deeper anyway. Even if I'm wrong, at least I proved myself wrong. Okay. So when these individuals come in, also too, think about the possessions that they have. What do they own? What's on their person? Is there anything there? Remember when we talked about them being escorted in, one of the key indicators or signs is, were they escorted in? Did somebody bring them in to the facility? And if they did, were they allowed to speak for themselves, or did the person speak for them? Okay. And it's like Kelly said, you've got to make that separation. You've got to get them away from one another. Okay. A lack of knowledge of where they are. Maybe they were smuggled in, and then now they're currently being trafficked. Okay. They may not even know their whereabouts. They may not even know that they're in Baghdad or wherever they may be. Okay. And then inconsistencies in their stories. When we talked about script and a rehearsed response, think about also too the inconsistencies that they may also have within their storyline.
So knowing that the basis of all adult trafficking involves those three core core elements of force, fraud, and coercion. Each question on the screening tool was crafted to reflect one of those core elements. Questions were identified as common across a number of screening instruments, although the wording may vary. The questions were carefully constructed to include indicators often seen in both labor and sex trafficking. The checklist is designed to be short, easily administered with minimal training, and designed so that you can integrate questions into conversations while simultaneously building rapport or listening for information. So the screening tools used to assess for vulnerable populations, including those who have experienced sexual assault and domestic violence. And just as a reminder, screening tools are used as instruments to help you know if a referral is necessary for further services. And these are really separate from clinical assessments. This is something I want to drive home to you guys who are clinicians, that, we're looking to basically identify potential victims. We're not looking to create a treatment plan. We're just looking to spot those. So I just want you to have confidence as you're doing this, to know you can do this. You can be a part of this to help. You just need to help identify those victims. And from there, there's other resources that we'll talk about. So I want to show you, so this is the tool right here. Okay, I printed one off and you guys are going to all get this. And I just want to show you, this is the clip on the screen of what you will get. And the questions that you're going to ask are meant to put the client, the victim, more at ease. So you're not directing the question to them. We want to word the questions carefully so it doesn't implicate them as a victim. So here's a few examples. I just wanted to read a couple off of here for you. So here's the first question. Sometimes lies are used to trick people into accepting a job that doesn't exist, and they get trapped in a job or situation they have never wanted. Have you ever experienced this, or are you in a situation where you think this could happen? And I would really encourage you, like I said, to read over these and make sure to know them pretty well so that you can be looking at the client when you're asking these questions to see their reactions and how they're responding. Here's another one. So sometimes people do unfair, unsafe, or even dangerous work, or stay in a dangerous situation because if they don't, someone might hurt them or someone they love. Have you ever experienced this, or are you in a situation where you think that this could happen? And then finally, this is one more. Like I said, there's a couple more on here. Sometimes people might not be allowed to keep or hold on to their own identification or travel documents. Have you ever experienced this, or are you in a situation where you think this could happen? So as Rich identified, that's something that this is, if they don't have their own documentation, that's such a big sign of why wouldn't you have that, right? So let's see here. Okay, so talking about the screening, so just kind of to set the stage for this. So before you do the screening, provide that information about what an assessment entails and ask them if they agree to the assessment and would like to talk about their answers. If the client does not agree to answer your questions, thank them for their time, give them some written resources to partnering agencies or organizations. And then if they say yes during the screening, you should remain calm, use an empathetic tone of voice, and show that you care and show concern for the client. Ask them about their concerns and if they would like help to resolve those concerns, including information and connection to other agencies that can assist them with meeting those basic needs of food and shelter. And then finally, at the end of the screening, make sure to go back to their concerns. So a question or two should be included about whether or not they're interested in other referrals. Asking the client if they want a referral allows them to have that sense of agency and choice. And it's a good practice, as we already discussed, for trauma-informed service, sorry. Okay, so this is of utmost importance. For the safety of all involved in these situations, you must adhere to privacy and confidentiality of the client. Screening for trafficking or any other form of violence must be done with dignity and respect. Screening should take place in a safe, quiet, and private space, and Richard already mentioned this, away from those who might be intent on listening for any reason. So you want to make sure, because you don't want them to say certain things because they're scared of how they're going to answer, that they're going to be retaliated against for what they say. So it has to be done in private. So by doing that, you need to separate that client, as we talked about, from any accompanying persons. And this can really be done by, telling the accompanying people that the agency policy does not allow for additional persons during examination or service, and that there's space provided for them in the waiting room. So make sure you're far enough away as well from them overhearing anything.
Another thing is you can, just to tail end off of of what Kelly just said, you could just fall back and blame it on COVID at this particular time.
True.
You know, most hospital settings now, just the patient is allowed to go back there and that's it, you know, because of that. And I know that's a short-term fix to a long-term problem, but it's an easy out during this current time to come back with that policy. You know, when we talk about effective responses to this, you know, we want to work within our own government to do so. So you want to contact the RSO for suspected issues and then engage with the Victim Resource Advocacy Program for support as needed. But also to don't negate the fact that, well, I mean, obviously go through the proper channels, but working with NGOs that are within the area can also assist and provide you with intelligence and so forth, because a lot of the NGOs in the area may be seeing other victims that are similar to the victims you might be seeing that might have information and that might say, yeah, we're aware of who she is or who he is. They came in with a large group of individuals who were smuggled in here. We now are treating several of them. Or we may have contacts at an office at one of our regional offices in the country that they came from. We can go get some background information from you. So don't negate the fact that the value of what an NGO can provide you as an intel source, but also as a support, because even one of the key things about trafficking victims is, you know, Kelly and I have talked about this extensively, is the continuation of services. Not just the service that you're going to provide them right then and initially during the screening process, but what happens after that? You know, do they get now, you know, sent back to the country of origin where they came from? And then once they're there, I mean, we're talking about individuals who have covered the whole gamut of trauma. You know, they've been, you know, whether it's sexually abused, physically abused, you know, substance abuse, you know, every spectrum of trauma a trafficking victim has experienced it. So it's unrealistic and naive to think that we're going to treat them in this short period of time and then, well, they're going to leave here and they're going to be like, all right, I'm good to go. That's not going to happen. So NGOs can kind of provide that gap to bridge between the screening, the identification, and then the long-term care, because we know that's kind of really important. And another thing too, if it's available, when we talk about this, some of the things we discuss is establishing some type of advisory board or task force that would include some people that might be liaisons with the local government, NGOs, community leaders, religious leaders, you know, and create kind of a memorandum of understanding between the two, that you guys will work together in order to not just identify these victims, but provide continued service for these victims. Because, you know, identification really is just the first step. This thing is really a process. It's more than just removing them from a dangerous situation. That's an event. But a trafficking victim is a process in getting them close to whole as they possibly can be after that traumatic experience. And with this group, you can also provide, you know, what we would say is public advocacy, because we know awareness, we know education will raise awareness, and then awareness will lead us to identification. And that's what the important thing is raising that level of awareness so that people feel educated about this to make informed decision. Okay. And then that informed decision, we talk about bringing in the NGOs or the community organizations. Those are the ones that can provide better assistance, shelter, resources, et cetera, after that. Awareness, we talked a little bit about that just now. I want to talk to you a little bit about a case study about this individual. I'll leave her nameless, but I felt the duty to show you her face, because you know, this is an investigation that I had personally been involved in, and she was a victim from the Philippines who was recruited for a job in 1981. She saw a job advertisement for a job in another country to work as a nanny and a housekeeper, and came to that country. The family that she worked for took away her passport, her birth certificate, She would work often 7 days a week with little to no pay at all. She slept on the floor, was provided only scraps, whatever was left after dinner is what she got to eat. And that was pretty much it. She slept on a thin sheet on a hard floor, and that's where she slept. She didn't even know how old she was at the time. And, she didn't speak the native language, which made things even more difficult through this. And she had seen a mental health provider on multiple occasions. She was taken to a medical facility because she had fatigue and vertigo. She was 78 years old. She had been held in domestic servitude for 37 years. I don't know how you give somebody 37 years of their life back, but all of the signs were there for identification. And luckily for her, she actually met a nurse that was actually at this medical facility who was recruited to come to that country to work the same as she was. But it wasn't a dubious offer. It was a legitimate offer. And she worked as a nurse. She spoke the same language as her and was able to find out. And she did all the right things. She had human trafficking awareness training for clinicians. She separated her from the individuals that brought her in because those individuals were speaking for her. And the nurse says, no, I speak her language and I'll walk back here with her, only she can come with me. And she went through the checklist and she finally asked her at the end, do you feel like you're a victim? And she says, yeah, I've been here since 1981. And one of our facilities went out and rescued her and put her into a rehabilitation. But it's kind of hard to this is obviously a sad story, but it's kind of hard to say, hey, listen, you're safe now. I mean, it took 37 years to get you there, but you're safe now. When we look at this, when we look at these case studies like this and these individual scenarios, this is just one of obviously many. But, the fact is that we know that educating people raises that awareness, and then that awareness triggers us to think harder on things. And, if there's a few things that I can drive home and Kelly, jump in when I'm done, is what she said is to take your time as you go through this process. It's difficult to properly do anything when we're rushed. And when we go through things like this, it's okay to deviate from the checklist, but, to ask more questions if you feel it's needed. And, I think it's extremely important, for us to provide this service to these victims, because like I said, no one raises their hand and says, hey, I'd love to be a trafficking victim. No one says that. And, I know a lot of people who are on this call probably have those sad stories. So think about if we can make a difference before that happens or shortly after it happens, and not allow them to become a statistic like this lady is, being a domestic slave and repeatedly physically, sexually, and, emotionally abused throughout that 37 period of time. So.
Okay, well, I thank you guys so much. We greatly appreciate it. The information is a lot, but I'm hoping that everybody has been able to digest it. And if there are any questions, feel free. It's open now. If you'd like to put it in the chat box or unmute yourself and ask questions, we'll be more than happy to assist you.
I do want to say, Tandis, before we get into the questioning, that we will provide this recording to you along with those screening tools in a PDF format that Kelly had mentioned, so that you can feel free to purview and distribute as needed to those who may want it or need it where they're at.
Great, excellent. And in the chat box, I think some of you have just chimed in, and I did my best to record everybody's names. If you are not in the GAL and you're an external email, if you can please in the chat box indicate your email address and let me know, and I will be more than happy to afterwards send it out. Also, if someone, like some of you have chimed signed in with just your first name, Joel or Lucas or Lourdes. If you can let me know who you are, if you're in the GAL, and the best way for me to communicate with you, that would be great. I'll try to write it as.
And while we're waiting for a few questions to populate, I just want to thank both Richard and Kelly for an outstanding job in the information shared and really covering the experiences that I know hit home for our clinicians and for all of us as advocates. And I just want to emphasize a few points. When you're engaging, please try to have at least water and crackers. I'm not expecting, you know, our clinics to have a full spread, but if there can be a pitch in of those few things to just triage and get people on the right track for being opening and starting that engagement phase, it really goes a long way. And I'm sure our offices can make a way to at least have those few things available. And also realize that the screening questions that Kelly went over are going to be something you can incorporate into your sessions, even if you don't make a full screening assessment part of the session. If you have a person come in, ask them if they would be willing to continue with your appointment by making the assessment part of it, and making sure that you say things like, well, I've seen people who've had a similar experience and they were unfortunately going through exposure to forced sex, or they were being made to do things that were uncomfortable to them. So figure out what the script looks like for you so that you're able to have those conversations in a more casual way. That may not be a checklist screening, but that can be something you incorporate into your sessions, whether they be of a mental health nature or more of a medical nature. Also, keeping referrals. If you need materials from us or from other entities in the office, have those readily available so that people can grab leisurely information. They may be much more willing to read something in the waiting room than open up and have the discussion. So if you need those materials, please do reach out to us and we will help you with getting some things that you can conveniently lay around. And also, don't let someone that you are suspecting of being a victim leave your office without something tangible you put in their hands, whether it be a pamphlet or a brochure with the RSO's number, with our contact information. We can email these things to you, and obviously you can print out local support materials. And then finally, just do whatever you can to get those people back to you some way. If you have individuals who you definitely have some suspicion about, schedule a follow-on appointment. Make sure you make some related reason for them to return so that you can keep eyes on them and that you can support them. You can see how they're healing. You can see if their treatment is applicable and is taking well, or that you can just let them know that if you're not ready to open up now, that opportunity remains. So with that, I think we have a few questions, and I'll turn it over to Candace. Were you able to glean anything from the chat?
I haven't seen any questions come in from the chat, but I was able to get down all of the emails. And just the last one, I will get it down right now. There's one question, it's from Gabby that just came in from Paraguay. We recently received a request from the local public ministry to train their TIP units on questioning victims of TIP. Is this presentation something we can use to prepare one in Spanish that is useful for them? Richard, Kelly?
Yeah, we can get this converted to Spanish. Do they want the PowerPoint or the PowerPoint and the audio converted to Spanish? We can work on getting that for you.
Gabby, is PowerPoint and audio or just one or the other? Which one? PowerPoint will be fine, she's indicating.
Okay, excellent. I'll make note of that.
Thank you. Any other questions?
And feel free to unmute yourselves if you do want to just chime in. You can speak up. I think we can conveniently not talk over each other if there are questions that anyone would like to share verbally.
Hi, this is Lucas Jones from Embassy San Salvador. And I just had a quick question. We went over a lot of different questions, and I was wondering if there was maybe, if you only had, a few minutes with this person in your interaction, is there a question or an observation that you would try and prioritize? Thank you.
Here, I'll go ahead and answer part of that, and I'll let Kelly jump in, after that. Obviously, when somebody comes in, this may be our only chance to actually visually determine whether they're possibly being trafficked or not being trafficked. And I think, most of us, when we look at, expressions, sadness is the same whether it's in Africa or it's in Asia or it's in, the Middle East or, or in the United States. It doesn't matter. The one thing about the way people have emotions or express those emotions are really, universal. And I think what you have to look at when we talk about the spot the signs, there's a handout that we're going to send out to you, or that'll be included in this. And you want to look at the fear and anxiety, the signs of obviously physical trauma with them, and are they in a position to be, we would perceive as vulnerable. And I think all of those you can pretty much get a quick snapshot of during an immediate assessment with them. And then going through the questions that are on that screening tool. The guide on that screening tool that says there's 7 questions on there, and it basically says if they answer yes to any one of these questions, then they are at risk of either being trafficked or vulnerable to being trafficked. So I think that you could pick one that's probably best suited to your area of where you're at, and I think asking them that one question that could parlay your questions further if need be.
And I would add in too, just thinking through a situation when I first started volunteering with Hope for Justice, I thought back to a situation I had 12 years ago of a patient in an adolescent clinic that I worked in. And I think back to the situation, and I didn't know about human trafficking then. I didn't know it existed. I most certainly didn't know it existed here in the US. And I think back to that situation, and it's really, talk about keeping you up at night thinking, I think I should have done something there, but I didn't know there was something to do. I thought it was a bad parent. It was a situation where it was a young girl with multiple STIs and had an abortion. She was 13 years old, and it was, the mom was there, and was it the mom? I don't know. So I think just what I would say is, Richard touched on this, but that intuition and knowing something's just not right here, and then deciding, hey, you know what? I'm going to take 5 extra minutes to pull them back to ask a few questions or one question. But I think a lot of it is that, knowing this exists and knowing what it does look like in the country where you are, and knowing, just knowing about it and knowing the things to look for are very helpful, even if you don't get to a screening questionnaire. So just wanted to add that.
Great, thank you very much. Any other questions? Okay, I don't see anything coming in from the chat box, and I believe I got everybody's contact information, and I will be, once I receive everything, I will disperse it. If there are no other questions, then we can just start with signing off. Is that okay, Mrs. Hall?
Sure, and if anyone has any final comments, feel free to add those, but I just want to again acknowledge all of the participants and thank you for being really a global committee and for what you do, and just realize that actions only take that one person to recognize, to start the conversation. And you may not have all the pieces or all the right words, but just don't miss something. Think of it how we would look at a child abuse situation. You err on the side of caution. You don't want a child to remain in a vulnerable position. So if you think it's there, there's likely something. And I think Kelly said this is, it's better to be or Richard alluded to it too, it's better to be wrong and screen it out than miss it. So just be engaged and be willing to have that conversation. Know you have RSOs that are there and want to look at situations at your post, engage them, and give them everything they need and let them take the ball from there on looking at what the situation is. You don't have to be the investigator. You don't have to be the judge. You just have to plant the seed of what you see and pass that forward. So thank you for all of what you do, and we're here to support you. Again, my appreciation.
Thank you, Kelly.
Kayla, hey, this is Steve May out in Baghdad. I just wanted to thank you and Tandis so much for this, as well as Richard and Kelly. I mean, it's amazing seeing who else is on this call. I was happy to see the Karachi Citizens Police Liaison Committee on here. They're going to, just how much we can multiply this around the world of having people more observant, whether it's Central America, Baghdad here, where it's like a small city, and everywhere else. So thank you all for putting this together for us.
Excellent. Thank you.
Much appreciation, Steve. Good to hear you.
Yes, and thank you guys for having us, and for all of you guys who have participated. It's really awesome, the care and concern for this and the need for it, and appreciate you guys having us here to talk about it.
Great.
Okay, everybody, stay safe from all over the world, and hopefully if you need anything, feel free to reach out to us, and hopefully we'll hear from you guys soon. Take care.
Take care, everyone. Goodbye.
Hope for Justice is an international nonprofit organization located on 4 continents with multiple offices worldwide, working to bring an end to modern slavery and human trafficking. It has an effective and proven model that is replicable, scalable, and widely admired. Our vision is to live in a world free from slavery.